everyone. Thanks for taking the time to be here with us today. We're going to discuss Turner and then go over a few intervention programs. Turner is a 5-year-old boy diagnosed with autism spectrum disorder. He displays an aversion to auditory stimuli and has moderate deficits in social communication, including poor eye contact, topic maintenance, and reciprocating conversations. Turner was identified as having a severe phonological delay and a mild to moderate mixed expressive receptive language disorder following the use of the PLS-5, the HAP-3, and an oral mechanism exam. It should be noted, however, that a re-administration of the HAP should be given at a later date due to the fact that Turner was partially non-compliant during the original administration.
Based on assessment results, parent reports, and clinician observations, we recommend targeting these areas in the following order: expressive language, receptive language, pragmatic language, and finally speech-sound production due to the evidence of a phonological disorder. Expressive language should be targeted first because Turner will be able to decrease his level of frustration when he becomes better able to communicate his wants and needs by utilizing functional communication. And receptive language should be targeted next because improving comprehension will result in less frustration over misunderstandings and will help the effects of other therapy targets to improve at the same time because he will be better able to understand the clinician's prompts that are given to him.
We believe that pragmatic language should be targeted after expressive and receptive language because at this age, pragmatic communication is primarily dependent on those language abilities. Additionally, more meaningful conversations will be gained when teaching nonverbal cues and appropriate conversation reciprocation, which will then further encourage development of expressive, receptive, and pragmatic language. Finally, speech sound production will be targeted after Turner begins to use functional communication to express himself. It is not appropriate to begin correcting speech sounds prior to emerging expressive language development. 2 interventions that we are interested in implementing are the Applied Behavioral Analysis, ABEA, and the Hannon program, which consists of multiple different programs, but we are specifically interested in the More Than Words program.
So ABA is a technique that focuses on preventing and changing undesired behaviors through the use of rewards and punishments. We thought this would be useful with Turner since his mom had concerns about communicating with his siblings, and this program can be implemented by parents and siblings once they are trained by an ABA certified behavior analyst.
The Hannon More Than Words program is for children with autism and their parents, and it works on interactions between parent and child. It is much more naturalistic, and a Hannon certified SLP will kind of coach parents through the process, teach them how to implement these things into everyday activities such as meal times or getting ready for bed. And parents should implement this program every single day. We feel that Turner would benefit from a program such as this because he will learn more from frequent naturalistic exposure.
Some things to kind of compare and contrast between the 2 programs. There is specialized training required for both, so therapy is initially started with an ABA certified behavioral therapist, while the Hannon program requires the SLP to be Hannon certified.
So parents, for implementing the treatment with ABA, there's a behavior analyst who kind of initiates the intervention, but the parents and siblings can learn how to incorporate this as well. Whereas with the Hannon program, for More Than Words, parents are the primary interventionists. Once they receive that training, they're able to implement that on their own at home.
We also thought both programs focused on social pragmatic communication, but with ABA it is very extrinsically motivated, so you're picking reinforcers that are of interest to the child and then eventually fading them out as they become more intrinsically motivated, while the Hannon program is more intrinsically motivated from the start since there are more interactions with parents one-on-one.
There is a time commitment for both programs. With ABA, the child might go through 2 hours a day for the entire week, so it can be up to 10 hours a week. But with the Hannon program, most of those hours are in the beginning of it, so parents are receiving up to 17 and a half hours of training, and then they kind of are more on their own as the program goes on.
A final kind of compare and contrast between the 2 programs is context. Again, ABA, since it is kind of extrinsically motivated, is very artificial, but as these reinforcers are faded out, it does become more naturalistic. And with the Hannon program, it is naturalistic from the start since there are more natural interactions with parents, caregivers, and the therapist. Thank you all for coming here today.